السلام عليكم واهلا وسهلا بكم في حلقه جديده من حلقات Introduction to ICP او Introduction to Interprofessional Collaborative Practice. Today's session is having a title of Patient Safety and Patient-Centered Care, and it's very clear from the title we have two main important components of today's lecture: patient safety and patient-centered care. Let's move on to see what we're going to do in our session for today. We start first by defining the patient. Maybe you think it's very trivial, it's quite known. Who is the patient? We know who is the patient, but actually trying to find a new perspective to the word patient. So we're going to reflect for a while on the word patient. Then we move on to a very important piece of work, very important report, and the title is amazing. To err is human. You know the rest of the proverb. To err is human, to forgive is divine, but let's focus on the first half. To err is human. Are we able to acknowledge mistakes? So we're going to discuss patient safety through the Institute of Medicine and WHO reports. Then we'll go to the second component of our lecture, patient care or patient-centered care. What is the definition of patient care, the philosophy, the principles, the rights of the patient? And as usual, we'll end our session inshallah with some concluding words about a new perspective, the way we want to consider our patients and providing care for patients. So let's start with reflecting on the word patient. I really want you to have some time, few seconds, a couple of minutes, 1 minute at least, to think about when there was a time you're sick. Maybe sometimes very sick. I think most of us at some point of our lives we got sick, definitely. I really want you to recall this memory. Maybe it's unpleasant, it's bad, it's painful, but I really want you to recall this memory live in your heads and try to think about the following. At that time, what were your feelings? You were feeling what at that time when you were very sick? What were your concerns? إيه اللي كان بيخوفك؟ إيه اللي كان بيقلقكوا وانتوا very sick? And more importantly, at that time, what were your needs? كنتوا محتاجين إيه؟ إيه اللي انتوا كنتوا عايزينه? So we need to focus on feelings, concerns, and needs. Please give it a shot. Give it like a couple of minutes at least. Try to think. Try to reflect. This is a very important activity, by the way. Not so many people actually have the time or the will to reflect on their daily behaviors. So then we move to this. If you can see the slide, it's a very simple slide. After you have been reflecting on the patient, the way he or she is feeling, their concerns, their needs. So I really hope that you agree with me that the word patient itself should not be valid anymore. Why I don't like the word patient? Because it reflects nothing about being patient. So I'm going to ask you again to reflect on the same thing but in a different way. Can you give a better word? Can you come up with another word, a better word for the word patient, so it can reflect your feelings, your needs, your worries or concerns? So I'm going to provide my contribution in this reflection. So I don't like the word patient at all. So I really believe that at some point we need to shift to this word. I really want to call him or her a care seeker. So we are care provider and we provide care to care seekers. And if you really reflect on the name care seekers, they're seeking care, they're seeking help, they're seeking support, they're seeking understanding, they're seeking safety, they're seeking so many things. And if we're lucky enough to provide them with what they really need or what they're really seeking, I think we'll be very fulfilled as professionals. So let's move on the other part. To err is human. That was a groundbreaking report. It's very, very, very important. I really hope that you have time to go and Google it. This report, it was issued late 1999, late 90s, and it was issued by the Institute of Medicine, واحد من الهيئات المهمة جدا جدا في النظام الصحي الأمريكي. What's really important is the facts, the numbers were amazing, or in other words, they were terrifying. So this report actually showed that about 2 to 4% of deaths in the whole United States, about almost like 100,000 people, 100,000 patients, they die every year as a result of what? Medication errors, mistakes, أخطاء, mistakes, up to 100,000 patients every year. So this report was issued to call for, call for a culture of transparency, شفافية. Let's admit that we're making mistakes, and let's try not to repeat the same mistakes over and over for the sake of saving lives. So what is the definition of medication errors? One of the simplest definition you can find is this one. It's any preventable event, and you can see here the word preventable in red, because actually it's very hard, it's a very cruel word. I believe that we all fated to die at some point. This is the way I believe. But there are always reasons. So patients are dying for our mistakes as health care providers. They're dying every year, and it could be avoided. So these are preventable events that may cause or may not, or may lead to inappropriate medication use or patient harm. This is a very dangerous word, patient harm. So this mistake may lead to harm, damage, or even death, while the medication is in control of the healthcare provider or the patient himself or herself. Such events actually can happen in different or at different levels, start from the diagnosis, the prescribing, dispensing, medication use, while operating a procedure, compounding, manufacture, education, monitoring. There's so many levels where these kind of mistakes can take place. To be more specific, we need to mention adverse drug events. Here, in this case, in these events, it ends up with patient harm. So any harm that is experienced by the patient as a result of using a drug or medication, we call it adverse drug event. If for any reason, for example, this mistake could be intervened, prevented, stopped, or for any reason like luck, حظ، قدر تدخل في لحظة ما, we call it potential adverse drug events. So it is adverse drug event when a harm is done, potential if this harm was prevented for any reason. So what about WHO, the World Health Organization? What WHO really thinks about the role of IPE, interprofessional education, the importance, significance of interprofessional education, especially when it comes to preventing, reducing, minimizing medication errors. Actually, WHO believes very much in the importance of IPE, as you can see in this very simple figure, that we have needs, local needs, patient needs, community needs. And if there's no IPE at all, there's no collaboration, so we have fragmented services. So everybody is working alone, separate islands, so there's no real connection. But in the presence of interprofessional education, we are preparing you. WHO is calling you the future health workforce. You, the workforce, following IPE at different levels, starting from lower levels. When you finish your study, now you are collaborative practice ready workforce. You are ready to practice collaboration in your workplace. So we are going to ensure collaborative practice. We are not fragmented anymore, and this way we can ensure optimal we can ensure optimal health services, and of course we are going to ensure improved patient health outcomes. So it's all about, this is the goal we should have in mind. And as leaders, I call you leaders, future leaders, it always starts with a vision for the future. And when you say vision, then you get goals. These are very, very, very simple words, but they're very deep, very profound, actually. To us as healthcare provider, Our main goal is patient outcomes, health outcomes, to improve, to ensure these optimized or improved health outcomes. So what about this? Do you know this? Do you like? I'm sure that all of you know this. Of course, definitely. كلنا بنحب Tom and Jerry, at least when we're young. And still, I have to admit that still I can watch these movies with my daughters actually. Tom and Jerry with this very famous piece of cheese. But actually, when I ask you a question, do you know it? Do you like it? Actually, I meant something else. I meant the cheese. This piece of cheese. This is called the Swiss cheese with a lot of holes inside. Why it's very important? Where is the connection between this Swiss cheese, small piece of Swiss cheese, and patient safety? We have a whole model called Swiss cheese model that has to do a lot with the patient safety. In this model, it assumes that this piece of cheese, it is composed of different, separate, multiple layers, and for each layer we have holes. This is exactly representing the different levels where a mistake can take place or can happen. So a mistake can happen on different levels, on the level of the organization itself, level of policy, level of healthcare providers, prescribing, diagnosis, dispensing, compounding, medication used by the patient himself or herself. So we have layers of this cheese, and the problem is when this mistake is infiltrating through these holes, eventually it will produce harm to the patient. And this is exactly what we want to intervene. So if at one layer we fail to intervene, then the second layer we should block this hole at all, so we prevent this mistake from reaching the patient and causing damage or harm or unpleasant ending. So this is the model, Swiss cheese model, that represents the different levels or different layers of events that can add or to patient safety, or the opposite. It can actually jeopardize patient safety. It can put patient safety at risk. So now we're moving to another important concept of this lecture, the patient-centered care. And to be honest with you, actually start with what we call a person, not the patient, any person, a person-centered care. We know care. We need to respond to certain needs, so we care for these needs. But why is person-centered or patient-centered? Because, as it's very clear from the title, this care has to be respectful. It should consider, it should respond to the individual, the personal, the patient, preferences, values, beliefs, needs. So this is very important. This should be the guidelines for this care, for any kind of care. Another definition, it's a simple definition, that this care should be meaningful. It should have a meaning. Not for the healthcare provider, not for me as a pharmacist or a physician or a health scientist or a dentist, no, for the patient, for the care seeker. It should be of value, not for us, but for him or for her. We have different perspectives here. So we think that we did the best, but if we ask the patient, then we can get actually a completely different answer, maybe shocking answer. What about the definition of the patient-centered care from a collaborative perspective, interprofessional collaborative perspective? So let's go through this very nice definition, and please pay very much attention to the words in red. So it's a partnership, so it's an alliance. We're working together. We're working together with the patient family, with the client, with the community. A partnership between a team. This is why we're going to in one lecture, we're going to discuss teamwork, a team of health providers and the patient, or a patient agent, من يمثل البatient, a patient family, for example, where the patient retains control. This is the most important word. أهم كلمة على الإطلاق. Patient should retain control. People needs to be in control. Control of what? Of their own health situation, of their own health status. So control over his or her care, and is provided access. وعنده access to what? To the knowledge, skills of the team members to arrive to a realistic, a team shared plan. So the patient himself or herself has to be engaged, has to be involved in making decisions that has to do with his or her own health. This is very important definitions. I really want you to pay attention for these simple definitions. What are the components, the main elements or principles of patient-centered care? We have so many models, but one of the most famous models is the Baker's Institute and Harvard School model they're adopting. Actually, it's very simple and it's very important. It's composed of eight principles. We'll go through them very quickly. So physical comfort, we have to ensure that the patient is physically at peace. He's not stressed physically. Physical comfort is very important. Respect for the patient values and beliefs. It's very important to consider what the patient thinks important, not us, him or her, what is important, what really means. Integration of care. We need to work in collaboration as a team, not individuals with him. To empower patients. One of the most very famous answers you get when you talk about patient empowerment, you get this answer: المريض ما يعرفش، المريض ما يفهمش، المريض مش مؤهل. This is the answer most of us actually are using, but it's a very wrong answer. ما بيعرفش، طب ما تعرفه. مش مؤهل، طب ما تأهله. ما بيفهمش، طب ما تفهمه. So this empowering, at least by knowledge, to have access to knowledge. Emotional support. The patient has to be understood. His or her emotion has to be taken into considerations. Sometimes we don't really appreciate human emotions as if we're robots ourselves. Involvement of family and friends. Sometimes it's very difficult to make decisions with the patient alone. We need to engage the family of the patient. The patient has right to have access to care, especially if it's emergency care. It's his or her right. Continuity of care. At certain point, we call it transition of care. داخل المستشفى وحيطلع. This is very critical point. A lot of problems happening at that point. Discharge أو admission. في اللحظات اللي فيها التشينج دي هي اللحظات اللي patient is very vulnerable, very sensitive, very susceptible to suffer from mistakes, medication errors. Now it comes the process of how we're going to apply the process of patient care. Patient care process is mainly composed of 5 steps, 5 important steps. Starting first with collecting as much as possible of relevant information. We interview the patient. We get as much relevant information. There are so many guidelines to have a proper patient interview. Then you assess. You start screening the information you get in order to help you to reach a decision, which could be a diagnosis, for example, or a treatment, or whatever the outcome. But at some point you need to assess, you need to evaluate this information. Then you put the plan, has to be share the plan with the patient, you implement the plan, and then definitely you have to follow up to monitor safety, efficacy, or whatever. So we have 5 steps comprising the patient-centered care process. Okay, what are the patient's rights? ما هي حقوق المريض? There's so many. There are human rights actually. The patient has the right to have a correct drug dose or route of administration, correct diagnosis, of course. The right to know, to be not in the dark, not to be kept in the dark, to know what's going on, to have access to records. The patient has the right to have confidentiality and privacy. I'm going to discuss this in detail when it comes to ethics. Decision, the patient has the right to make his own decision, or her own decision, what we call in autonomy. The patient has the right to be heard, to be listened to be safe, to be protected, to be educated. And we have this kind of philosophy. Before you medicate, you have to educate. And of course, if there's any emergency treatment, the patient has the right to have it. Of course, it's very important to go through what we call evidence-based medicine. What is evidence-based medicine? It's a philosophy of practice, approach, the way we make decisions that has to do with the patient himself or herself. That has all the decisions that has to do with the patient has to be based mainly on best currently available evidence. Best currently available evidence. That's very important about evidence-based medicine. Then, evidence-based medicine, what is it? Actually, it's like 3 important elements playing together. First, Of course, as we said in the definition, it has to be based on relevant scientific evidence, the best currently available evidence. Also, it has to include the clinical judgment, the clinical experience of the healthcare provider. Definitely, experience has to do something here. But what is very important, and in most times is overlooked, الناس بيتجاهلوه أو بيقللوا من أهميته, which is the third element, is patient values, beliefs, preferences. البيشنت بيحب ايه، بيكره ايه، مؤمن بايه، بيعتقد ايه. Sometimes this is even more important than the evidence and the clinical practice if we're talking about the patient health needs. So even though the title is evidence-based medicine, it has to include, to consider the patient preferences and patient values. Then please, at any moment, at any time you are making a clinical decision, remember Tom Cruise, that was a movie actually, I think it was late 90s or early 2000 something, Jerry Maguire. In that movie he was saying all the time, show me the money, but this time in this lecture I'm saying, show me the evidence. Now, to end this videotaped session, I want to leave you with a very simple take-home message, which is, when it comes to adverse drug events, when it comes to patient safety and patient-centered care, it's very important to look to the patient as an expert in his life. I'm sorry, excuse me with the title. The title is not adverse drug events. The title should be few last words on patient-centered care. We need to look to the patient as an expert. Never underestimate the patient and his life experience. We don't know anything about that, but it's very important to consider because it can shape our plans in providing care to the patient. I think there's only one single slide left, which is thank you very much, and I hope you enjoyed this session. Thank you very much.